everyone, my name is Rachel York and I am the UT Extension agent in Unicoi County. And so because I work with a lot of families in that area, I'm going to be focusing my project on homelessness in Unicoi County. As I was deciding who to interview for this presentation, I looked towards our Community Alliance Network, which is a group that meets once a month to go over different happenings in the community. We talk about different projects going on, needs of the community, ways to get involved. And we have many different organizations that are represented. You can see here we have the Health Department, Family Violence Shelters, Crisis Pregnancy Center, groups that kind of help the same people, who are maybe in poverty, maybe need court assistance or different types of things. And so this is a great group to look for someone to talk about something like homelessness. So I spoke with Michelle McNabb, who works with our health department. She's our health educator, and so she has a similar role to me in where she works with different families to help their health and nutrition. So we work together quite a bit. I also spoke with Debbie Tittle, who is our Register of Deeds for the county, but her passion project right now is working with people in the Prevention Coalition. And so their focus is managing addiction in the county and finding ways to reduce our high rates of opioid addiction and other types of addiction. So when I asked Debbie and Michelle about why homelessness exists in our county and even in our region, they agreed that opioid addiction was a big part of this situation. And so I've given you some statistics about our poverty rates. We have a 17.3% poverty rate, which would be high. And then I've also given you some statistics about opioid addiction. So in this chart here to the bottom left, it shows you the death rates from 2012 to 2015. And so I know these look low, but you have to remember that we're a pretty small county. We're a population of about 17,000. And so we're not going to see a lot of high rates of those, but it still is an impact. And you can see in this chart here to the right that we have the number of outpatient visits and hospital stays. So we do have higher rates of people taking drugs and being affected by them, but we don't necessarily have as many deaths. And so this data is a little bit older, from a couple years ago, but they did say in my interview that these numbers have risen. They said that they've even doubled, and so the problem is only getting worse, and that is really negative for solving the problem of homelessness in our county. One of the main questions I had for my partners were what's being done to aid the situation for those in poverty and those who are homeless. And there are so many services that I did not realize were even available. And so it was a great way for me to become more educated on what's out there. And so I've given you a few of the community partners that they discussed in our interview that help the homeless and those in poverty, and I'll talk a little bit about those. So the health department is a really great resource for all income levels, especially lower income. So they have resources for child health, primary care, STD control, nutrition. They help women apply for their WIC benefits, which are just vouchers to buy nutritious foods. They have child special services, prenatal care, health education. There's so much that they can do to help. And so they discussed how their biggest struggle in working with the community was that they don't always get the outreach that they need, or people don't necessarily know that those services are available to them. And so they've worked a lot this year to be more well known in the community. And so I'm hoping that people will use them more because they're a great resource. And our health department is great and very smiling, welcoming faces. And I think it's so important that they're not judgmental, they're just kind and wanting to help. The Prevention Coalition is a little different. They don't work one-on-one so much with individuals. They approach the opioid crisis and addiction issues in our county from a broader standpoint, and so they look more at ways to affect more people. And so their project recently that they've been working on is to install more drop boxes in our county. And so a drop box is just a safe place that's secure that you can put your prescription medications that you're finished with. So if you are not going to use it anymore, then you can drop it off there and it's disposed of correctly, and it won't just be left in your house where someone else could access it. So I've also given you a little bit about some other partners in our community. CHIPS is a family violence shelter that is an excellent resource. They're also in Greene and Carter counties. They work with families in crisis, so women and children who have had a violent outburst in their home and need a place to go stay. They provide shelter, they provide assistance finding a new home, they provide financial care, groceries. If you need it, they are there to help you. So that's a really great one. Door of Hope is a crisis pregnancy center. If you are low income or homeless, then this is a great resource. If you need access to diapers, clothes for your baby, sometimes housing, I know they'll help with just about anything that you need. So if not, they'll at least connect you to someone who can. And then I've also given court-appointed special advocates, which is CASA. And so they work mostly with children, but they get so many unique cases that they see this a lot, where they have to help someone that may be homeless or in poverty. So these are all great partners that are not just in Unicoi County, but are for our region. And so I would encourage you to explore those organizations in your own area and just be familiar with what's out there. And I also included this article from the Irwin Record, which is our local newspaper, that they just posted today. And it says it's a new project that aims to help the homeless. And I was so excited when I saw this. And so it says Medic One Medical Response and the Red Rock Resale Shop have joined forces to provide assistance to homeless individuals in Unicoi County. So Michelle from the health department sent this to me today because she knew I was working on this. And so she said, here's one more thing that Unicoi County is doing to help the homeless. And so the idea is that people will fill up buckets with needed items and it will get dispersed to whoever needs it. So I'm excited to see where that goes. I hope that it's a big help, but it's great to work in a county where people are thinking of others, and I think it's a great place to work. So just to conclude, this interview and the discussion that I had with our CAN group was a really great way to remind myself that homelessness and poverty are real issues in my community, and I was really excited to learn about the different services that are offered and what we can do to help that population. I also really didn't have a good understanding of what caused homelessness, and they don't have all the answers, but I thought that the discussion of addiction and specifically opioid abuse was really interesting. So I'm excited to learn more about that. New data is coming out every day, so I'm curious to see some more recent data, but that's what they had available, and they shared some of that with me too. So it was a really great experience, really great to talk with them. I would just encourage everyone to utilize the resources that you have in your community, refer people to the health department, become involved in those types of organizations. So thank you guys.